Good morning and welcome to the Village Who. My name is Paul Martino and I'm one of the co-founders of Village MD, and I'm thrilled to be here this morning. The Village Who is intended to help our team get to know each other as well as some of our patients. Come on in and take a listen. We're coming to you from Westchester County, New York, and I'm here with Anthony Viceroy. Good morning, Anthony.
Good morning, Paul.
Tell me about you.
So I've been with Summit now for a little bit over a year.
Hold, please. Let's back up. Let's start with where are you from? I love the raspiness in the voice. It's got to be. I'm going to make the mistake and say you're from the Queens?
No.
So where are you from?
I was born in the Bronx.
Born and raised?
Born and raised in the Bronx. Lived there for about 25 years.
Yeah.
Eventually moved to Westchester County, Pleasantville, with 2 kids. I went to school in Pleasantville. And about 3 years ago now, I moved to Greenwich, Connecticut. So,
sounds like the all-American story. How did you come to Westmed? Tell us about that.
So before Westmed, I spent 10 years at Omnicom Group, which is a Fortune 200 marketing communication company.
Yeah.
I was running a global public relations firm. We were in 90 cities, 60 countries. I lived on a plane. And when you have little children, it is a very tough schedule.
Yeah, I imagine.
So after about 4 years, I wanted to do something a little bit different. Came to Westmed, didn't necessarily have a healthcare background. I worked in biopharmaceutical previously in my career. And 11 plus years later, I'm still here, and it's been wonderful.
So you've been with the company 11 years. How have you found it? Does healthcare seem easy, complicated, confusing?
Extremely complex, very different than any other industry I've been in. But I would say very rewarding. I think more than any other industry right now, there's a lot of purpose that is driven from what we do. It's very complicated to take care of sick patients and to do it against regulation, cost pressure, staffing issues, and to do it at the very highest level, and to work as part of an organization which is now 20,000 strong and growing is exceptional. Probably the most rewarding job I've ever had in my life. And I've been doing this for 32 years now, so long enough.
Right. So as Westmed and City and Summit all came together, your responsibilities expanded. So you're it in the northeast part of the country. Myself, along with Dr. Adam Barronson, who's our chief physician executive, we run a dyad model for the Northeast, so it covers pretty much what was the tri-state area, and now joining Village, it's pretty much the Northeast region. Yeah. How do you spend your time? What are the things that you find yourself really thinking about on a regular basis? Most of the day is working with our great COOs in our regions, trying to help them navigate through all of their complexities and all their issues. My view of being in more of a corporate role is how can I leverage the system to the benefit of our regional leadership to get them to be able to perform and do the things that they need to do, which is help their physicians take better care of their patients. As we've gotten larger too, the complexities have grown. So you kind of try to navigate these choppy waters. Yeah. So as you think about the future of healthcare, all the rage for the last 10 years has been quote unquote value-based care. How do you see that? Do you think it's going to change the patient experience for the better? What's your view of that? I do think that it is definitely going to put a lot more accountability around taking better care of your patient. The patient experience, I think we at Summit and I know at Village as well have been focused on delivering great and high level patient experience anyway. It will evolve in time. And I think that as patients continuously get more educated around their needs, especially what they are able to pay for and not pay for, the experience will model after that. So I think like anything else in any industry, you will evolve over time. And continuously get better at it. Greatest satisfaction on the job. What really gets you going? Working with people. When I got into this profession, it was about people, process, and technology. And the process and the technology is so important, but it doesn't really motivate me the same way as dealing with people does. It's just something that I think every day you have an opportunity to learn from people who see things a little bit different than you do, bring new experiences, can teach you something, and hopefully you can help them along the way as well. So I find that to be the most rewarding, and I would spend all of my time visiting the clinics if I had that amount of time, because I love being out there and actually seeing what goes on and how care is truly being delivered.
Yeah. Interestingly, we did a site visit yesterday with Blue Cross of Michigan, and we were in one of the sites in Florham Park.
Yes.
And just being around the staff there, it's unbelievable.
It's unbelievable.
It really is. So last question for you. Anybody alive, dead, doesn't matter, any place on earth that you could go, have dinner with whoever you want to have, where is it and who are you having dinner with?
One, and only because I studied him a bit in business school, I was a big fan of Winston Churchill. I think leadership when times are good is easy. Leadership in a time of adversity and to rally a whole country to fight and to come out on top is amazing. So, plus he liked a good cigar and a good scotch, so there's nothing wrong.
Sounds
with
like
that.
you two were made for each other.
So I would say probably Winston Churchill.
Awesome. You've been great with your time.
No, thank you, Paul. Appreciate it so much.
Good morning, Amy.
Good morning.
I'm here with Amy Lhote this morning in Sarasota, Florida. Where are you from?
I was born and raised in the Pittsburgh area, but north of Pittsburgh in a rural area. So I am a coal miner's daughter, and I owned a practice up there. It was Ford City family practice. Yeah.
And so how did you get into your profession? Like what caused you to want to be a care provider?
So my mother tells me that I was 9 or 10 whenever I said I was going to be a nurse. And it never swayed. I always knew that was my calling. So I went to nursing school, got my bachelor's, and never looked back, and always was the overachiever, doing ICUs, cardiac things, and then it kind of landed into family practice. I had worked with a physician, and he asked one day, he said, let's open up a practice.
So you did?
So we did.
Did it work?
It worked very well, yes. So we had a couple thousand patients within a year, just from word of mouth.
Yeah.
Yes.
Yeah. So that's what good care providing does, right?
It does, yeah. It was always value-based care, so I feel right at home here.
How long have you been with us?
Since November of 2021.
So talk about that a little bit. If I think about a company like ours that has no probably brand recognition in this community. You moved to Florida, so you're a new resident, and you joined a company that you've never heard of before.
Yes, so I read on Indeed, and I read about your philosophy and the value-based model. So decided to apply. When I moved down to Florida, I had worked in a large system, and it was what I call assembly line care.
Yeah.
And
so the opposite of value-based personalized care.
Absolutely. And it was so foreign to me because that's not how I treat people. I want to know them personally. I want to take care of them well. And I was seeing 24 patients a day they didn't allow me to have my own patients. So it was like 24 sick visits a day. So I don't like that. I like to know my patients, have a personal relationship with them, and give them great care. And that it went completely against what I had done my whole life, that giving that holistic care.
So what characteristics do you think matter when you describe that care versus, you call it assembly line care?
Yes.
What characteristics matter in developing that kind of rapport with patients?
So if you know them on a personal level, then you know how they are emotionally, what's in their environment, what's impacting their physical symptoms, and it's all connected. So if you don't know that, you don't know that person completely. I love to treat chronic disease.
Yeah.
I feel that if you get to know your patient and they trust you and you can teach them about their chronic disease, they are going to be more compliant and they're going to want to take better care of themselves. And that's important to me.
So I think what I heard you talk about was establishing rapport in a relationship with the patient and listening.
Correct.
Yeah.
Yes.
Yeah. The reason I asked that is because my mom, who lives in Connecticut, is 89 years old, and I was visiting her a few weekends ago. And I asked her how she was doing health-wise, and she said, I'm doing fine, but my doctor never listens to me. And I thought about that, and is that a common experience? Is that an uncommon experience? And then I thought about my own doctor, my own primary care doctor, and he's been my physician for 20 years or so. And it so struck me because I don't actually think he really listens to me either. I think he knows that he's got a job. He thinks that I know a little bit more about healthcare than the average person that he sees. But I don't think he really listens. I think he just wants me to, tell me what's going on and move me out, if you know what I mean.
Yes.
And he's part of a health system.
That's one of the main things that I hear back. Is thank you for taking the time and thank you for listening and getting to know me. As a person, not what I do for a living, what I've done, but who I am. So, this idea of co-locating primary care with pharmacy, so Walgreens, this is where we are today. So Dr. Fields one time at the beginning of our journey with Walgreens said, if you co-locate the most commonly used provider, which is primary care, with the most commonly used service, which is a prescription, you're probably going to get a better outcome. So as a care provider in this co-located clinic, how does that work for you? Oh, I think it's great with the collaboration. We have great pharmacists here in our co-located pharmacy, and it's nice to just pick up the phone. They just pick up the back line, say, what were you meaning by this prescription? I need some clarification, or I don't have the medication. Can I send them somewhere else? Can we use something else? I had it in my small town where I was from. But I have it here also. So that's very important. But as far as I believe, and we use the MedSync a lot, and the MedSync for my patients, I know that they're going to have to come maybe once a month, once every 90 days. I have that backup that they're going to actually get the medications that they need.
So then what I think I heard is better compliance with the medications that they need to be taking.
Yes. And then that personal touch, you can go over, if you do need something over the counter, you can go over, get what you need. If they need supplements, if they need some calcium, vitamin D, that type of thing. I always write notes to my patients, but I also, if I walk over with them, get what they need. And then I know that it's not going to just have the note sitting on the counter.
It's an important part
We've
of the
already
care.
went.
What I'm going to ask you is if there's one place in the world that you could be or go, where would that place be and why?
Italy. I haven't been there yet. Yes. Tuscany is on my list. Yes.
Amy, you've been great with your time. Thank you.
Thank you.
Good morning, Amy.
Good morning.
Sue.
Good morning.
So I haven't been in Sarasota ever in my life, and I was greeted by a warm, sunny March morning.
We live in paradise.
You do. So
do.
Amy, let's start with you. How did you end up in paradise?
I had lived in the Pittsburgh area and owned a practice up there for about 15 years, sold to a hospital system. Came down on vacation to Fort Myers, and by chance, listening to live music, met my husband.
So now you're in paradise and you have paradise.
I am in paradise and I have paradise, correct.
Sue, what about you?
We were planning to retire, originally from New Hampshire, lived there 57 years, and then had a short interim of 8 years in North Carolina to finish out our working careers and thought, now where? So we retired in the spring, and this was a place where we had good friends, which was second best to family that are all still in cold New Hampshire.
So how did you two meet each other?
So I had a wonderful relationship with my doctor in New Hampshire, the same doctor for 27 years, really respected her.
So this is a primary care doctor?
Yes, yes. And so when I went to North Carolina, I couldn't quite find that. I floundered around. I switched doctors, which is very unlike me. And so when I got down here, I was very specific about what I was looking for, and I started asking every woman that I saw in the pool, who do you go to for primary care? And Amy's name kept coming up. So one day I was driving by and I stopped by and said, is she taking new patients? And she happened to be behind the counter and said, I'll take you now. So off we went, and it was just a great relationship right away.
So what was important to you? You said that you were floundering around in North Carolina.
I think I like small practices, and I couldn't find that. I like to know my mechanic. I like to know the tellers at the bank. I like to know the veterinarian. I like a small practice where I can walk in and people recognize me and I recognize them. So right off, this is a small space that I really liked, but I just liked that Amy and I looked at each other and just kind of had this connection like you would with a new friend or someone that you want to get to know.
So what I hear is relationships matter for you.
Definitely.
How about for you, Amy?
Oh, absolutely.
So say more about that.
My relationship with my patients, our practice up north we had about 5,000 patients whenever we sold the practice between two providers. And I knew them inside and out. I knew all about their family. I knew about their life, what they have done. That's very important to me, to have that personal connection. And I think you can give better care whenever you know that. When you know a person, you care about them, and they know you're sincere about it.
So how's it been? I think you said earlier you've been here 5 months?
I've been in this practice about 5 months, yes.
And have we met your expectations?
Oh, most definitely. Amy was very thorough. I had just turned 65. I needed to have all the Medicare intake things. The office was efficient with making the referrals that I needed to get all the records up to date, things I had completed recently, things that I hadn't completed recently that we needed to know about.
So you're new to Medicare also?
Yes.
How'd that transition go?
For me, it went fine.
Awesome. So talk about the clinic for a minute. You said you like small because you like it to be more personal.
I do, but I like bright and crisp and clean. I love the window. I've told more people about this. I think it's a window. It may just be a dropped light in the ceiling that's just gorgeous. It just brings the outside in, which is what you're here for in Florida, is to be outside.
Yeah.
So, and inside it's just intimate, and everyone's very friendly, regardless of whether or not you're headed in that room or this room. Whoever you pass has something to say that's kind and welcoming.
So the clinic itself is appealing. The staff is welcoming. Amy and you have a personal connection.
Definitely.
So I want to ask about the pharmacy, because that's always a question that we get asked. And the way we've thought about co-locating the clinic within Walgreens Pharmacy is for the convenience of the patient. And so tell me about that a little bit. Does that work for you?
It does. I had some issues after flying and being with some sick grandchildren, and I had to see Amy on a quick basis before I flew again. And I think the difference of having a back door to the pharmacy was amazing to me, but it also made it feel like this was part of the pharmacy. We didn't go out the door and then go back in the front door. We went out the back door past the nurse's station, and a door I didn't even know existed. So I was just in awe, and Amy went right to the aisle where we needed an over-the-counter something and said, this is what I think will help, and this is how often you should take it, and this is this, in addition to being able to access the prescription that I needed. So very, very convenient.
That's terrific. So a lot of times when I do these interviews, I ask the person that I'm talking with, if you could have dinner with anybody in the world, who would that be for you, Sue, and why?
That would be my maternal grandmother. She was from New England like I was. She was a kindergarten teacher. I was an early childhood educator. I just followed in her footsteps in so many ways. She passed before my daughter was born. My daughter is her namesake. And I just would love to reconnect with her to let her know how important and what an influence she had on my life.
And how about for you, Amy?
I've read a lot about Steve Jobs.
Yeah.
And how he was that entrepreneur that really influenced the people that he worked with, and always used his passion to continue with his company. But it's very important to me to continue to progress. I think Village is perfect with value-based care for sure.
Yeah. Ladies, you've been great. Thank you.
Thank you.
Very much.
Thank you.
Thanks for listening in today, and I hope you found the conversation enjoyable. Please tell your friends, and remember to listen in the future. Have a great day.